Hello everyone, Tony Maritato, physical therapist here. So in this video, I want to talk about the Comfort Track Cervical Traction Unit. I want to share my experience with it. I want to tell you why this is the unit we choose to use in the clinic. I want to tell you why, if you've been prescribed a cervical traction unit for home, what the options are that are out there, and why I still to this day, was September 2019, I believe this is probably dollar for dollar the best value on the market. It's not the highest quality, but it's the best value. It's the best combination of all the components. So let's talk for a second about cervical traction, what role cervical traction might have in a home treatment program, and when, at least for me, I believe a patient might be appropriate for a home cervical traction unit. So typically what happens is, they may have some what we call radiculopathy, some pain that radiates, maybe numbness, tingling, pain, altered sensation that radiates down one arm, down both arms, or even just across the back of the neck. These symptoms tend to increase as the day goes on. A common scenario is patient wakes up in the morning, their neck is stiff and uncomfortable. They don't have a lot of range of movement, but maybe they don't have the symptoms down into the hands or down into the arms. They go through what we call a honeymoon period, kind of mid-morning. They've been moving a little bit, they feel a little bit better, they've had their coffee, they're up and about. But then as the day progresses, all of a sudden the nerve symptoms, where in the morning it was more stiffness and pain, now it's starting to become more of a nerve sensation. The pain is radiating down, maybe lower into the arms, maybe into the hands or the fingers. And they're experiencing these symptoms with greater intensity. And over the course of several days, weeks, months, they're experiencing these symptoms with greater frequency. So these are the patients, these are the situations, the stories that are very common that we would see in the clinic, and that may, once cleared by their physician, may be appropriate to trial a cervical traction unit. Now, I don't do a lot of what we call medical equipment dispensing. I don't think we need a lot of stuff at our house. I can tell you, I live in a house with 4 boys, my wife, I don't have room for more stuff. But for the right person at the right time with the right symptoms, this is one of those devices that really does make a difference. It does not cure any kind of pathology, but it helps provide you with a tool that you can use to manage the symptoms. So let's talk a little bit about how it works and what you're going to do with it. So it's a pneumatic device. It's powered by air. This little hand pump, as I pull it out, you can see the headrest rise. There's a button on the front. If I push it, the headrest will fall back down. There's a gauge. Now, I'm going to give you kind of my experience. This isn't necessarily what is recommended for you. Before you use a device like this, you must be assessed by a physician, by a physical therapist, by a chiropractor, by somebody who understands your condition, can test and make sure that everything is safe for you to use. This is just an educational video to give you an idea of what options are out there. Quite often, patients will arrive at my clinic with a referral and an order from their orthopedic surgeon for a cervical traction unit. We check the insurance coverage, and typically what happens, now this isn't universal, but typically what happens is most insurance plans will have a separate deductible for medical equipment. So a typical plan, maybe you have a $1,000 medical deductible, and maybe you say, well, that $1,000 deductible has been met. Okay, awesome. But now this is a medical equipment, medical device. Often there's a separate deductible, maybe $500. And I can tell you right now, you can pick up this device on Amazon for around $300, $350 brand new. But if it goes through a medical equipment company, it's not unusual that they might charge $700 for it, because there's other services that they're providing along with it. And so if you have a $500 deductible, you can pay out of pocket $300, $350 on Amazon, or you can go through a medical equipment company, pay the full $500 deductible, and then the insurance will cover a percentage of the balance. You're going to end up with the same device. So if you have questions about insurance, let me know. I can post a separate video. But in the meantime, just understand that sometimes it's less expensive to just buy the equipment directly than it is going through your insurance. So let's get back to the mechanics. So as I pump, you can see that the headrest will slide up. These little knobs here, I'm going to turn it so you can see it a little better. These little knobs are going to rest right under what we call the occiput, those bumps on the back of your skull, bottom back of your skull, right at the top of your neck. It should be a comfortable fit. There are little mechanisms behind here that allow me to make it wider for a larger neck, narrow for a smaller neck. You just want to find something that's comfortable. If you follow the standard recommendation, you can pump this up to a certain amount of pressure. But what I typically find works best for most of my clients, and truly what works best for me, what feels the most comfortable to me, clinically, if a patient is experiencing pain, soreness, discomfort, the way our bodies react to that pain is by tightening, by guarding. And when you think of the musculature that crosses the neck, it goes from the top of the shoulders and the rib cage up into the base of the skull, into the vertebral bodies, the bones in the neck. When those muscles are tight, they're going to pull down on the head and they're going to pull up on the body, right? So if my head normally weighs 12 to 15 pounds, when those muscles are pulling tight, it's like wearing a 40-pound helmet. You can imagine how it's going to compress down. And this is typically experienced when somebody turns their head and maybe there's some grinding or clicking or popping. If we can relax some of those muscles, occasionally those sounds will dissipate, will lessen. That's how we know somebody's responding to treatment. That's how we know that a lot of the pathology they're experiencing, the symptoms they're experiencing is coming from a reflexive guarding through the muscles. So my goal when I use this for a client is never to stretch anything. I'm never going to overpower the musculature of your neck. I'm never going to overpower the reflexive response, the natural response within our body to protect and guard. What I'm going to do is I'm going to try to produce a little bit of distraction, a little bit of pressure. I usually target about 8 to 12 pounds at the max. And the hope is that the body will relax. That relaxation will turn down the tension in those muscles, allowing the neck and the vertebral bodies to naturally open up a little bit, naturally gap a little bit. So if there are bone spurs, if there is stenosis, if there is a narrowing of the canals where the nerves are going through, maybe we get just a little bit of space in there. Maybe we create a little bit of suction, which allows the synovial fluid, the nutrients to come into the joint. And then when you come off the device, kind of everything squishes back out, but we facilitate that fluid exchange. And the body just relaxes. That protective alarm, pain is largely a response, an alarm system to say, hey, something is going on, there's danger, we need to do something. So we want to kind of turn down that alarm system a little bit, right? Turn the volume down some. So this isn't the optimal treatment table. This isn't my normal treatment table. I typically like something totally flat. If a patient is going to use this at home, if they're able to get on the floor, I recommend they get on a carpeted floor. If they just can't get on the floor, they could do it on a bed. And typically what we do, if you look at the back of the device, we put a board, a clipboard, something under there just because it's going to sink into the bed and we need some firmness for it. But I'm going to lay it down. I deflate the unit so it's all the way down. I'm going to go ahead and get into position. But before I do, one other thing. So they do have this strap that would, in theory, come around and come over the head. Typically when I'm using it for a patient in the clinic, I don't use the strap because then if they pump it up too high, the strap kind of confines them and locks them in place. What I typically do is I leave the strap off If they pump it up too high, the worst that's going to happen is the device is just going to slide up the head, but it's never going to apply too much pressure. If a patient has a prescription and has been assessed by a physical therapist and been told exactly what to do, how much force, how much pressure, how much time, and they want to use the strap, that's their prerogative. But I can just tell you that for me, safety always comes first, and I will never push the boundary of safety to try and improve an outcome. Most of my clients, I explain on the first day, I would rather you not get better than see you get worse, right? Nobody wants to get worse. So let me jump up here. Let me show you what I'm talking about. Hopefully the camera can pick this up. So typically we come in, I position this, I relax, there go my keys. I relax here and I feel these little knobs. Now there's zero pressure on my head, my neck, my shoulders. The knobs are just right on either side of my neck. I'm gonna bring these in just a little bit so that I feel full contact. I'm looking up at the ceiling, I'm completely relaxed. So most times I will ask a patient to just lay in this position without even pumping up the handle or anything, because the little bit of flexion that happens in the head will already start to open up the canals in the posterior aspect of the spine, possibly start to decompress just by doing this. Now once I've laid in this position 1-2 minutes, I'm speeding it up for the video, I will go ahead and start to pump. And so as I pump right there, I felt just a little bit of movement. If I look at the gauge, I've got 5 pounds of pressure, and it's perfect. For me right now, I feel a little bit of distraction. You might have seen my head tilt up and my chin fall back just a little bit. Sometimes you might have heard chin tucks or cervical traction. That's exactly what the machine is doing for me, but I can relax into this position. And quite often what'll happen is you'll start and it might read 5 pounds. But as I relax and as I settle down, and sometimes as I fall asleep, the gauge will start to move up, not because the device is applying more pressure, but because my body is settling down into position. So at this point, let's say I leave it on 5 pounds for a minute or two, totally relaxed, no symptom, irritation, no problems. Maybe I decide, hey, I want to go up a little bit more, so I'm going to take it up. And right there, I'm sitting between 8 and 9 pounds. That's just absolutely perfect. I feel the distraction, I feel it tilting my head. It's not sliding or moving or doing anything uncomfortable. I would typically ask my clients to turn their palms up because that opens up the chest and the shoulder. I might ask them to kind of readjust and squeeze their shoulder blades back, tuck them underneath their body, and then just rest in this position. I usually look for a 10 to 15 minute treatment episode. They're relaxed, they're comfortable, they're thinking about their day. Hopefully they're dozing off because they're so relaxed. And then at that point, when they're ready to end, I'll come over, we'll pick it up, we'll slowly, and you can just do that by controlling how much pressure, deflate. Now all the pressure is gone, the gauge is back to 0, and I'll typically have them stay in this position for another 1 to 2 minutes. So we started with 2 minutes before we applied pressure. We applied pressure to the 5 pound mark for about 2 minutes. We went up to the 8 or 9, max at 10 pound pressure for a 10 to 15 minute episode. And then we released the pressure back down for about 2 more minute recovery. All in all, you're looking at less than or about 20 minutes total. Now that I'm done, I go ahead and sit up. I see how it feels. And that feels great. You should feel like something is different. You should feel a little bit relaxed, a little bit, I say, rejuvenated, kind of clear-headed. I feel good. And so back to kind of the reality. So there is another brand, it's called the Saunders unit. They are kind of the gold standard when it comes to cervical traction as far as I'm concerned. They usually run $500 to $1,000. They are amazing pieces of equipment. They're about the highest level home unit somebody can purchase. but for the extra money, I don't think you lose anything when you look at the Comfort Track brand. I'm not endorsed by them. I'm not receiving any payment for this. I just think it's important that the public, get a chance to hear the perspective of a physical therapist who's treating patients in the clinic, what we use, why we use it. Now, I will say, we've had these units going on probably about 10 years now. One of the other units, we had a little malfunction with the pressure release. And it just started leaking air. So we pulled it out, we cleaned the gasket, we put it back together, and it's fine now. It's a working unit. Aside from that, the other thing that will sometimes start to happen is the gaskets in here. So normally when you buy it new off the shelf, whether you push in or you pull out, the carriage will rise. On this unit, because we've used it so long, when I push in, I get the carriage to move, but when I pull out, well, it worked that time. Sometimes it works, sometimes it doesn't. Nonetheless, it doesn't lose air. It maintains that pressure pretty well. And that's about it. So guys, I'm not recommending you get this. Please understand, this video is strictly for educational purposes. The neck, the nerves coming out of the neck, these are vitally important parts of your body. You have to have them medically assessed by a healthcare professional. A chiropractor, a physical therapist, a physician, somebody who understands what they're talking about and has a chance to talk to you about your entire case history, everything that's been done, possible surgical history. There are lots of factors that would make this inappropriate for you. This is the internet. Unfortunately, I've never had the opportunity to meet you, talk to you, ask you questions. So that being said, I cannot say this is for you, but I can say that if you've been prescribed a cervical traction unit, this is a pretty good deal. So guys, if you have questions, as always, post them in the comments. Let me know what you're wondering. Let me know what your experience have been. Have you used a traction unit? Did you use the over-the-door? So just real quick, why don't I like the over-the-door model? They sell them for 25 to 50 bucks. The problem is you have to overcome the weight of the head already because you're sitting up. There are some that let you lay down, but nonetheless, the way they come around the neck and under the chin and press up into the jaw tends to irritate some of the joints within the face. And I believe that for $25 or $50 compared to $300, $350, I think the lifetime value of this is far outweighing the short-term value and money saved on an over-the-door unit. They're just not going to do the job the right way. You want to be able to recline, to lay back, to totally relax your body. Okay. Subscribe to the channel, ring the notification bell. I hope to bring more content to you if you find this useful. Otherwise, as always, thank you for watching. I'll catch you on the next video.